Hi guys, welcome back again to Nursing and Therapy. It's me, Adobe Okoye, and I am a nurse. Okay, today I'm going to be very fast and I want to go straight to the point. And what I want to talk about is very important as usual. These days, people die, and for some reasons that we don't even know about, and some things that we can actually prevent. And it's just unfortunate that it's only when you have lost someone that you love or that you love. That's when you would understand how it feels when someone says, I lost a loved one. The point of this video today is to remind us of what we can do, of what we should do to, help ourselves and also take care of our loved ones in some situations, when they are very unwell. They don't even need to be unwell before you take care of them. Today I'm talking about health insurance. When you are from a place where it seems like nobody cares about you, no one cares about your health, the government does not even care about you, have to take charge of your health. I know so many people know about health insurance, but yet so many people don't know about health insurance. I'm going to talk about health insurance just very briefly so that we'll understand why it's important and why everyone should get health insurance. Like, you should be insured, notwithstanding your age, notwithstanding your sex, notwithstanding whatever you do, because health insurance is open. They have different plans and you can either pay monthly or pay yearly. And so let me just explain how it works. So health insurance is a means, or is a plan whereby your health is insured, it's covered. And I would say your basic needs. It's unfortunate that it doesn't cover everything, but like I put it, it covers your basic needs. So now, how it works is this: when you are insured with a company, they are in charge of your health by being the middle person between yourself and the hospital. So now, if you choose to be insured with a particular company, you'll be given a list of hospitals. It depends on your location, the one closest to you, the one you are happy to attend. Also, it depends on what you can afford. If they give you that list, the health insurance company would be the middle people in charge of your health. Like, they'll be the people communicating with you and also communicating with the hospital in some situations. Now, what is it that the health insurance does for you? So you can get insured in two ways. You can just go yourself and you choose the plan that you want based on their individual plan. Then there's a corporate plan for the company. Even having a corporate plan as a company, there are different levels. You can be on the basic, like the lower level. You can be on the middle level, and then you can be on the higher level. Even as an individual, if you go to register with them, there's still different plans for the individual depending on how much you can afford. So back to what I was saying, how does it work? When you're fully registered with them and you agree to pay your premium, is it monthly or is it yearly that you want to pay for? Depending on the contract you sign. Whenever you are unwell, you walk into that hospital that you chose, the hospital that is working together with that health insurance company, which is supposed to be your primary care provider. Now, this primary care provider is in its way acting as your primary health care center, which the government should be the funding, if you get what I mean. Now, because in some countries, the primary healthcare centers, or let me say, in some places, the primary healthcare centers don't really function well, not in everywhere, like in some places. So the health insurance now will stand in place of the primary healthcare center. So whenever you're unwell, you walk into that place that you chose, that you wanted to be your first point of contact, that primary health provider, if you get what I mean. So you walk into that hospital and you tell them, oh, I'm registered with this company. So the hospital would send a message to the company, oh, this person is here. And it is the responsibility of that company to tell them, yes, the person is registered under us, treat, right? So anything that is happening between you and the hospital, they will be letting the health insurance company know about it. So then in some situations whereby if it's something that the plan you chose does not cover, what the hospital does is they will just let the health insurance know that this person maybe has a procedure or has a surgery or has something, whatever, and the plan does not cover it. What are we going to do? Now, if you're an individual, like if you're someone that just walked into the company and decided to just use the health insurance company as your primary, they're the ones in charge of your health, they could call you and tell you, we can pay this money for you and then you pay us back. There's a way they do it. Or if you work with a company, still the same way. They would be speaking with you and your company, and this is what they can do for you. What does it do? In that way, you will still get that care that you deserve. You don't need to pay immediately out of pocket. If you can afford it, of course, They can just tell you, right, we would cover this and you pay the rest of this. So what am I trying to say? What I'm trying to say is that at at that point you're getting the care that you deserve. You're not going dying in silence. You're not going because you can't pay. That's why you need that health insurance company so that you will get the care you need at every point. Okay. And then I wanted to say something, but don't forget that it's usually subsidized. If you walk into a hospital as just a private patient and you just want to access care without being insured, what they will charge you is different from what they will charge someone that comes in as being insured with a health insurance company. So these are the benefits of having health insurance. You get healthcare subsidized for you. You are assured that you would be taken care of. You can be given time to pay off whatever you owe. Okay, institutions whereby you cannot even pay immediately depends on your company. Your company, because of the health insurance company, may decide to pay something that you are not, like, just pay it off for you, and then gradually be deducting it from your salary. So ultimately, what this does is that it covers your health. You'll be taken care of. And remember the point of this video. You'll be taken care of because it looks like you have to take charge of your health. In a system or in a country where things are working, everything is functional, everyone is generally insured. Just choose a primary health care center where you need to be going to. But if the government does not do it for you, then you have to do it for yourself. You have to take care of yourself so that if eventualities happen, like if anything happens, you would know that you tried. And the sad truth is that health insurance company, they don't cover everything. Yeah, it doesn't cover cosmetic surgeries. I don't know if I've been able to explain to you, convince you, and not to confuse you why you need health insurance. You are certain, like you're sure to a very reasonable extent. Out of 10, I would say you are sure. Let me just give it a 6, okay, or a 7, that your healthcare needs are covered. And then there are some disadvantages, like I said, because they don't cover everything, you still pay out of pocket. Then another disadvantage is that if your health insurance company don't keep up to payments, they don't really pay their hospitals what they're supposed to pay them. It could be a problem there in the sense that you may go to the hospital, they'll be like, oh, we're not attending to your company or you because your HMO is not paying us, things like that. Okay, I don't know if I'm forgetting anything, but that's why I have the comment section. And I've worked with the HMO before, so I know how it works. But it's just like I've forgotten so many things. But I know the benefits, and I know the benefits outweighs the disadvantages, or let's say the advantages outweighs the disadvantages. So it's beneficial for everyone to be insured. So that if anything happens, you've done your best, you've given it your all, you've done what you're supposed to do. And don't forget, I said that health insurance is not just for adults. It depends on what you have. Like, you have to look at your life first. I gave an instance that it's for the whole family. They have packages. They have for individuals. They have for the husband and wife. They have for husband and wife with children. They have, you know. So the plan you get for your child might not be the same plan you get for yourself, because you might be having other things that basically that children might not be having, something like hypertension. So if you're getting a plan, everything depends on how much you have. You get the one that if you can get the one that covers your monthly medications, that would be good. Okay. Health insurance work with pharmacies, they work with medlab scientists, they have doctors, they have nurses that follow up with your health. They have people that reach out to you, refer you to different places that you need, give you some worsening symptoms advice, give you some health advice in case of anything, like in case you're concerned about anything. So you can easily ring them if you are confused about anything, and then they'll refer you to a hospital or advise you on what to do. I think this is even very important for people that have got chronic diseases like diabetes and hypertension. I keep mentioning them because it's just very common, because they take monthly medication. With the health insurance companies, we have people, the nurses and doctors, that follow up with them, give them health educations, they ensure that their monthly medications, they are refilled. And in situations where they have to interfere with the hospitals to, for any particular care, they come in. It's a lot actually, but I'm going to be stopping here. I just made this video to let you know about the importance of being insured, the importance of HMO, especially in a place where it looks like you are just the one. If you get lost today, nobody cares apart from yourself and your family. If you die today, no one cares apart from yourself and your family, obviously. So I'm just encouraging everyone out there. There are different HMOs. There are different HMOs. There are different HMOs. Please get insured. For now, I'll be stopping this video, and you can always ask your questions. This is nursing and therapy. We do everything good, everything beautiful that will make you happy, that will make you smile, and that will prolong people's lives. So you're welcome to ask your questions. You can please like, you can please share, and then leave a message or comment. Thank you very much for listening, and I'll see you guys some other time. Bye.